It's very challenging at this
Yeah.
point because there is a lot of concern about being immunocompromised in this context with a pandemic and with the negative consequences of the infection. However, we are not recommending that people discontinue their medicines for fear of the underlying diseases becoming active, and we know the natural history of these diseases. What we would say is that that's really a decision that's left to the physician, the treating physician, and the patient, and that should be handled through what we call shared decision making that takes into account individual preferences, takes into account things like what is their level of disease activity. In some patients, we would recommend that we taper the dose or the frequency or the dose of their medicines. If they're doing very well, we ought to be thinking about doing that anyway, even in normal circumstances. If they're in, for instance, rheumatoid arthritis in stable remission, we should be thinking about spacing out their medicine anyway. And that doesn't necessarily happen in this country at the frequency that it does, for instance, in Europe. So there are opportunities to do that in consultation with your doctor. But there are other circumstances where we really wouldn't want to do that. There are a number of factors that have to be considered between doctor and patient here, and it's a very individual case-by-case choice. For instance, if you've had a number of infections on your biologic in the past, there's more concern that your immune system may not be optimally functioning and that you may be at greater risk in this scenario. That might be a situation where a physician and a patient decide, yeah, we're going to taper down or maybe even stop the medicine for a period of time. And contrarily, it might be that you've had particularly severe disease that you've finally gotten under control after being on multiple medicines, and that the disease has threatened organs or your functional capabilities. In that situation, I would not be thinking about discontinuing medicine in this scenario. And the other thing is that some patients have very strong opinions about this. Some patients have educated themselves about the risks, and they want to be off that medicine. And I'm not sure as a physician, in the absence of good clinical data, which unfortunately we just don't have yet, I'm not sure I would go against a patient's strong preference to be off drug. But again, we'd have to have a method of communicating if their disease flared up and if they changed their mind about how they wanted to handle that. So, and then the last thing to caution everybody with, and all rheumatologists out there know this, and patients should know too, you cannot stop prednisone abruptly because it can be life-threatening to suddenly go from a significant dose of prednisone to zero. That drug particularly has to be, and any corticosteroid has to be very carefully and slowly tapered down if you're going to try to get off of it. That's unique somewhat in the drugs that we use and should be handled carefully in that respect. All of this should be handled with a call to your doctor. If you're concerned about being on these medicines and want to think about tapering down or stopping the drug, you really need to contact your physician first, because there are ways to do that more safely than just doing it on your own.